Hello everyone, and welcome to another weekly Moments in Medicine Live, brought to you live on Nebraska Medicine's Facebook page. As we begin every chat, we want to remind you that the information we share today is to be used for informational purposes only. So if you have questions about your specific treatment plan, please consult with your doctor directly. So today I'm very excited. I'm joined with Nebraska Medicine orthopedic surgeon, Dr. Scott Vincent, and physical therapist, Shelly Walker. And I just learned, how long have you been working here, Shelly?
32 years.
32 years. That's amazing. And then tell me again when you joined on board.
I started in August of 2017.
Wonderful.
So I've been here just about a year and a half.
Awesome. So we're kind of the newbies. So Dr. Vincent and Shelly are both part of our comprehensive spine program here at Nebraska Medicine. Keep in mind that while you're watching the live chat, I'll be kind of looking at the Facebook page with you. So if you have questions or comments, post those, and if we have time, we'll address them. Even after the chat is done, if you want to post them after the fact, after you've had a chance to watch the whole thing, we can definitely address your comments after that as well. Let's get started. Please describe what the comprehensive spine program is and what makes it so particularly different and comprehensive here at Nebraska Medicine.
Yeah, so the comprehensive spine program was recently designed and developed to give patients an efficient and simple way to access care with regards to any spine pain or problems. And the goal of the comprehensive spine pain program is for any patient with any sort of spine problem, whether it's been one day of back pain or years and years of back pain and problems and multiple surgeries, to access our system in a way that they can be seen quickly and efficiently and be plugged in with the correct provider to take care of whatever problem they may have. And the comprehensive nature of it is we have the resources and ability to take care of the most simple to the most complex problems of the entire spine.
We do like to talk a lot in these chats about the multidisciplinary approach to care. So can you just kind of give a high-level overview of who's on the team and, again, what makes it so special?
Sure. So we have orthopedic spine surgeons, myself and my partner, Dr. Cornett. We have neurosurgeons that also take care of and specialize in spine problems. There are physical therapists. We have non-operative spine providers, physiatrists who specialize in the non-surgical care of spine problems. We have pain management and interventional specialists who do a lot of injections and other non-surgical procedures for the treatment of spine pain. We also have nursing staff that help triage various spine problems to different providers. What else am I missing?
You better list everybody or start chiming in on Facebook.
I'm going to get some nasty grams.
Well, I think much like a lot of things in medicine, prevention is key. And I'd like to talk to you specifically about the physical therapy side of things, because I know from personal experience, sometimes I land in the PT because I didn't do some of the preventive stuff ahead of time. So my first question, talk to me about the treatment of neck and back pain, and can you tell us a little bit about how patients can restore their movement and also decrease their pain when they finally get to you in physical therapy?
Well, I think the important part is that we're able to identify each patient's individual problems. Over the years, you've developed compensations or bad habits or some muscle weakness, and that leads to abnormal movement patterns and overuse and chronic pain symptoms. And so to really identify each person's individual dysfunction and then to design a program that's going to focus on each of those dysfunctions,
Sure.
I think that is the key to it. And we really want to give the patients the tools that they need to be able to manage this on their own. We don't want them to have to keep coming back over and over so we can fix them, but we want to be able to give them the tools, the exercises, the stretches that they can do to be able to maintain their improvement once that they've gotten it.
I've learned over the years that core strength is so key. And so you mentioned the exercises, and I have to laugh because I want your opinion, and I'm going to, those who remain nameless, who have been, prescribed physical therapy exercises, how many do you think take your advice? They do the exercises there on site because you're watching them, but how many do you think take the advice and do it when they're home? And what's the importance of sticking to the routine that you give them?
I would say probably 60% of them do it at home while they're attending physical therapy.
Sure.
And then they'll keep going for maybe a month. But once they've been pain-free, they forget.
Yeah.
And so then they fall back into their bad habits, and some of their old pain patterns come back, and we get to see them again.
Well, I say, and I was surprised. I know when I went through treatment, they'd be like my issue was in my back, but they'd be working necessarily on my hip or like my upper, and it was all connected with, whether it was the nerve or the flexibility was huge. So what's your favorite part when you're working with a client in terms of just, is it easing their pain? Is it kind of pointing out the fact that, hey, this affects down here, you'd be surprised? What do you like the most?
I like when they see the improvement in daily functional activities.
Yeah.
Just little things that I was able to walk through the whole grocery store and I didn't have to go sit down. So just those little moments when I'm like, oh my God, do you see what I just did?
Sure.
And
you fix those, like I said, what are maybe in their mind little problems so that you avoid the surgery down the road if you can.
Right.
Yeah.
Right. Hopefully, if we're successful, they don't have to have surgery.
Yeah. So talking about all the procedures and techniques that you offer, give me a high-level overview of what some of those that you use and who can benefit from those.
Yeah, so I would say to start, back to the therapy side of things, the vast majority of spine problems and the bulk of what we see is actually treated non-surgically and often treated very successfully with things like physical therapy and other non-surgical modalities. The thing that's great about Nebraska medicine and our providers is that we, if it comes to surgery and it comes to the point where we think that surgery could potentially be beneficial for these problems, we have the tools, the resources to really do any sort of surgical procedure that may be necessary on the spine, whether that's from the cervical spine and the neck, the front, the back, whether it's the thoracic spine or the low back, the lumbar spine. We really can do anything from small outpatient procedures to much larger and complex deformity correction, revision surgery, traumas. We take care of some cancer patients and do some tumor surgery as well. So we're able to use all sorts of techniques. We use minimally invasive techniques when we can and are able. We use, we've recently started this rapid recovery protocol where we're working with some of our specific low back patients on getting up and mobilizing after surgery early and getting them out of the hospital quickly. And that tends to lead to a better pain and a faster recovery, and so we've been utilizing techniques like that as well.
So tell me how patients can make the most of their appointments. What are some good questions that they can bring to the table so that you're not doing all of the teaching, they're actually bringing some investment to the appointment themselves?
So the biggest thing I would tell patients is to really be specific about what it is that hurts and what bothers you and what specifically you can and can't do and what your back or neck problem and pain doesn't allow you to do. The more specific you can be, the better we can really hone in on what the problem is and then potentially offer you a solution. And I'll tell patients, spend a day or two thinking about this and then write it down and bring that with you. And that can be very helpful for us. And no detail is too small, and so we really appreciate it when people are able to specifically describe in as much detail as they can what's bothering and where it hurts, how it hurts, when, all of those kinds of things. We also like to know other things that they've tried, if they've already been to physical therapy, if they're taking medication for this problem, if they've ever seen another provider, or had surgery or an injection. All those things are important for us when we make decisions about these things.
You mentioned earlier kind of the new protocol that you have in place to try to get people out of the hospital. Are there other new techniques that you would want to mention today?
From a surgical standpoint, we are using a lot of navigated techniques, which is fairly new. We're using some intraoperative computerized navigation to really maximize the accuracy of some of the hardware we use in surgery. We're using some minimally invasive techniques when they're applicable, also using some motion sparing techniques in primarily the cervical spine. So those are really kind of the newer sort of techniques that we're using in surgery.
So with as long as you've been working here, you've probably seen a lot of changes over the years, but for someone who just thinks, man, you guys sound really knowledgeable, I want to come see you, tell them where you can access these services today. Obviously today we're here at the Lauritzen Outpatient Center.
Yeah, I think that you can go through the website and you can link in with the comprehensive spine program, and we have nurse case managers that collect all the information and they get you to the proper provider, and then they can send you where you need to go quickly.
Yep.
So that we can get you started.
Yep, and the other nice thing about this is that if a patient really wants to see a specific provider, we can certainly accommodate that and make that happen. If they're not sure who they need to see, whether that's a physiatrist or a pain management specialist, that's when our nurse navigators can help them decide based on some questions they'll be asked and things on where they may need to start.
All right, so to get started, you can call the 1-800-922-0000 phone number. You can also go online to nebraskamed.com. When you talk about searching for some of the doctors, each of the doctors have a really easy way to find them. It's a find a provider link, and you can type in either the type of service that you want. If you happen to know the doctor's name, you can type that in. They also have video profiles, which are really slick. Feel free to, again, comment after the fact, and then join us next week for leukemia and lymphoma. I'll be back. I don't think I even introduced myself. I'm Heidi Woodard. And then the following week, we're going to be talking about some soccer injuries. And I'm not going to promise anything, but we're looking to get some fresh talent in the hosting mix. Because personally, I am running out of outfits to wear. So we're going to get some new talent in here. Again, thank you again for joining us this week. And hopefully we'll see you next week for our next Moments in Medicine Live.